an ectopic pregnancy is actually an obstetric emergency, and it's a life-threatening condition which can actually take your life. And therefore, if it's possible, we should make more efforts towards controlling the occurrence of an ectopic pregnancy, because as you've heard, it's an obstetric emergency which can actually take your life or cause severe damage to your fallopian tubes and maybe
Nutrition Therapy by Lucy. This is a channel where we talk about food, good nutrition, and health. Thank you for your support, for always watching my videos, leaving a comment, giving them a like. I am so grateful. But if you're here for the first time, please make sure you hit on that subscribe button, the red button. We get to learn all together. For the new subscribers, karibu sana. Feel welcome. Here we talk all matters nutrition and health to make sure that we have a healthy lifestyle. We've been doing episodes on pregnancy, and today is no difference. We are going to handle a topic on pregnancy, and that is ectopic pregnancy. And with me, I have a specialist. He'll be taking us anything we want to know about ectopic pregnancy, and we get to learn together. So, Daktari,
yes,
karibu sana. Maybe you can introduce yourself to the audience, the name. Yes.
Yes, my name's Paul Mshire Yaira. I'm a clinician here at St. Scholastica Uzima Hospital. I work as a clinical officer in the outpatient department.
Oh, karibu sana daktari. So daktari, what is an ectopic pregnancy?
Okay, an ectopic pregnancy is a pregnancy that implants outside the normal implantation area, that's the uterus. And in this case, an ectopic pregnancy is that situation whereby the pregnancy gets to implant in the fallopian tubes rather than the usual place, which is the uterus. Yeah.
So because I understand after the fertilization takes place in the fallopian tube, the egg and everything are supposed to be pushed to the uterus.
They move to the uterus, yes.
So what are some of the causes of the risk factors for the ectopic pregnancy?
The risk factors for an ectopic pregnancy, we have, for example, consistent use of these emergency contraceptive pills, which can predispose somebody to getting an ectopic pregnancy, yes.
So you want to say like the frequent taking of the emergency pill can predispose a woman
can predispose somebody to getting an ectopic actually. Yes.
So my people must hear.
In some other cases, it's just natural.
It can something natural without no medication. Your body just.
Yes, it can. It happens.
Oh, okay.
Yes.
So my people, you've had P2, not something that should be taken on a daily basis. And maybe how many times in a year are you supposed maybe to take an emergency pill?
We say in one cycle. That's from the last time you had your menses to the next one. One should not use it at least more than 3 times.
In a year?
In one cycle.
In one cycle?
Yes.
Okay, so my people, you've had P2, not something to take on a daily basis. If you need any family planning method, please get one. But for the P2 you've had, you're predisposing yourself to cases of ectopic pregnancy. And so, Daktari, when you have I believe ectopic pregnancy, the symptoms are similar to those of maybe a normal pregnancy. What are some of the signs and symptoms that a doctor can diagnose that this woman has an ectopic pregnancy?
Okay, an ectopic pregnancy is actually a surgical emergency, and it's not. The symptoms are not similar to any other thing.
Okay.
But this one, when it comes as an emergency. So the first symptom somebody will experience is a sharp pain on the abdomen, that at times can be associated with vaginal bleeding. So the patient can come bleeding, but most of the time they come with a very severe abdominal pain.
Okay.
Yes.
And maybe at what stage of the pregnancy, first trimester?
An ectopic pregnancy cannot be cannot be diagnosed outside the first trimester. It's usually the first 3 months of pregnancy.
Oh,
Yes,
okay.
yes.
And maybe you can take us maybe through the treatment, what a woman can expect.
The only treatment of an ectopic pregnancy is an emergency laparotomy. That's surgery. Yes. It's a surgical emergency, in other words.
And I
Yes.
have heard of a ruptured ectopic pregnancy, and maybe a woman gets to lose maybe one of their fallopian tube. Kindly
Yes.
tell to our audience what is exactly that.
Now, a ruptured ectopic is now that's the complication of an ectopic pregnancy, whereby now the patient will present with a very severe pain, with abdominal pain, with severe vaginal bleeding. Huh? Yes.
So, and once you have a rupture, can you completely lose one side maybe of your fallopian tube?
It's very possible. Yes.
And maybe, is there hope for maybe a woman who has undergone the ruptured ectopic? Can you conceive again after an ectopic pregnancy?
Yes. The fallopian tubes, they're bilateral, so there are two.
Yeah.
There is the left side and the right side. So if this one is completely damaged, it means somebody can conceive using the other one, which has been spared.
Oh, okay.
Yes.
And maybe maybe an ectopic pregnancy, once you have one, can it recur again?
Yes, it can recur. There is a possibility of recurrence.
Okay, my people, I hope you are learning something on ectopic pregnancy. I hope you took your pen and a notebook so that we get to learn all together. Okay, Dr. Paul, maybe
Yes.
you can, maybe your parting shot to the audience.
Okay, my parting shot to the audience is that an ectopic pregnancy is actually an obstetric emergency, and it's a life-threatening condition which can actually take your life, and therefore, if it's possible, we should make more efforts towards controlling the occurrence of an ectopic pregnancy, because as you've heard, it's an obstetric emergency which can actually take your life or cause severe damage to your fallopian tubes, and maybe if the other one is not functional, then you might end up not getting a baby in your life.
Oh.
Yes.
And maybe I can add on something. Maybe the earlier you start your antenatal clinic, the earlier maybe it can get diagnosed.
Yes. Actually, for example, in our setup, every mother who visits, the first visit we do an ultrasound scan, which can actually tell us where exactly the implantation has taken place, and therefore if there is any worry of an ectopic, so the patients will be let to know earlier enough.
Oh, wow.
Yeah.
So that is it, my people, about the ectopic pregnancy. I hope you've learned something. Let me get to know what you've learned in the comment section. And as usual, give this video a like, share, so that this information can reach as many people as possible. But don't forget to subscribe to this channel, Nutrition Therapy by Lucy, because here is the only place you get to learn about nutrition, good health, and all about food. So bye-bye for now.